Take a closer look in Spotlight. And joining us now is Ziv Cohen, a clinical assistant professor of psychiatry at Weill Cornell Medical College. And Dr. Cohen, is that consistent for people who would go through some sort of sexual assault who have things like, problems academically or fears of confined spaces?
Yeah, it can certainly happen if you've had a traumatic event, sexual assault or other kind of trauma. That can lead to symptoms of PTSD. Not most people who experience a trauma do not develop PTSD, but a significant minority will develop PTSD. And the kind of symptoms you could have could include problems concentrating, problems in relationships, problems with intimacy, problems falling asleep, a variety of symptoms.
Now, could the episode or the incident itself cause somebody to misremember things about the incident or the identities of the people who were involved?
Well, I think that memory is a tricky thing, and of course this cuts to the heart of the matter in this case. When you're experiencing a very charged, when you have a very charged experience, then certain things are going to be highlighted in your memory and other things may be drowned out. I don't know that misremember is the best word, but I think that certainly people who have experiences that are traumatic may remember certain things very accurately and other things less accurately.
And I know that some people who have been through traumatic sexual assault, sometimes their mind essentially blocks them from remembering a lot of things just to try to protect their own mental health.
Sure. In fact, sometimes they don't remember anything from the experience. They have a complete blackout or they completely dissociate from the experience.
Especially if it happened to them as children or younger.
Sure, if they happen to them as children, but certainly any time in the life cycle that can happen. So absolutely, when you have a traumatic event, you may searingly remember certain details. You may remember no details. So there's a lot of variability there. And I think that that's part of the problem with this situation is that nothing that we heard today is dispositive one way or another. I think that you can conclude that both of these individuals strongly believe what they're saying. They seem to me to both sincerely believe what they're saying. But nothing that they're saying allows us to conclude with certainty who's telling the truth.
We are having a national conversation, whether Judge Kavanaugh gets confirmed or not. A lot of people are talking now about sexual assault. For people who go through this, what are some of the ways that they are able to either process it in a healthy manner or deal with it in a way that is productive for them?
Sure. Well, I think that getting treatment is very important. Whether or not a person even has full symptoms of PTSD, it can be really important to get into therapy, talk to a professional, process the experience. It may also require medication. There are medications that can mitigate the symptoms of PTSD. And it's also important to realize that in most cases, symptoms that people have after a trauma are going to rapidly diminish over time. So in most cases, there can be an expectation of a really good recovery. But it's important to be followed by someone clinically so that if some symptoms are persisting, they can be treated quickly before they become, more difficult to treat.
Is there ever a good case of not revisiting what happened? Because maybe if it's so traumatic or so troubling that would cause more damage to the person is trying to understand why they behave in a certain way or have certain issues?
It can be. So there are different approaches to the therapy for PTSD. It used to long be believed that the gold standard for treatment of PTSD is what's called prolonged exposure therapy, which is literally talking about it so many times that you essentially become desensitized to it. You can talk about it as if it was happening to somebody else, and the memory is less painful for you. But more recently, there's been research that shows that types of psychotherapy that actually don't involve reliving the experience at all can be just as effective for the treatment of PTSD. So I think that it's important for the patient to pick a therapist and a technique that they're comfortable with.
Dr. Ziv Cohen, a clinical assistant professor of psychiatry at Weill Cornell Medical College. Dr. Cohen, thanks as always. We appreciate it.
Absolutely.
And it's now time for